Welcome to today's explainer. Right now, as we speak, there is an epic, high-stakes battle raging all around us, and it is completely out of sight. We are talking about the invisible war between microscopic pathogens and the human body. Honestly, it's a conflict that has literally shaped human history, and understanding how it works is one of the absolute most powerful tools we have for survival. Okay, let's dive into this mission briefing. Today, we're going to cover Meet the Microscopic Invaders, Your Body's Defense System, Breaking the Chain of Infection, Medical Diagnosis and Treatment, and finally, the Future of Global Health. Section 1. Meet the Microscopic Invaders, the pathogens that start the fight. You know, infectious diseases aren't just random illnesses that happen for no reason. They are caused by actual living microscopic organisms that invade the body, multiply, and do some serious damage to human tissue. And this brilliantly illustrates the two most common invaders we face: bacteria and viruses. Their unique biological structures totally dictate the types of diseases they cause. Bacteria, for instance, are these single-celled organisms responsible for heavy-hitting illnesses like tuberculosis, cholera, and pneumonia. Viruses, on the other hand, are even smaller, and they actually require a living host to multiply. They literally hijack our cells. These are the culprits behind things like COVID-19, influenza, and HIV/AIDS. And knowing the difference isn't just an academic exercise. It dictates exactly how we fight back. But hey, bacteria and viruses aren't the only enemy combatants on the field. We've also got fungi, which cause conditions like candidiasis. Then you have parasites, which are highly prevalent in tropical areas and drive devastating diseases like malaria and toxoplasmosis. And finally, there are prions. These are exceptionally rare, but they are uniquely deadly, responsible for conditions like Creutzfeldt-Jakob disease. Section 2. Your body's defense system, the internal battlefield. When these invaders actually manage to breach our outer walls, they're met by an incredible multi-layered defense system. First up is your innate immunity. Think of these as your immediate first responders. This includes your skin acting as a literal physical wall, your stomach acid completely neutralizing ingested threats, and these amazing cells called macrophages that just swallow up invaders whole. Then you've got your adaptive immunity. This is your highly targeted, memory-driven special ops team. It uses B and T lymphocytes to create specific antibodies designed to hunt down a precise pathogen. It ensures that if that specific enemy ever tries to return, your body is ready to destroy it instantly. However, sometimes our natural defenses just get overwhelmed. When the body starts losing the battle, it throws up some major emergency red flags. We're talking symptoms like difficulty breathing, severe chest pain, altered mental status, seizures, a high fever accompanied by neck stiffness, or even septic shock. This isn't just discomfort, this is visible evidence of an escalating crisis. It means the front line is collapsing and requires immediate, emergency medical attention to prevent irreversible damage. Section 3. Breaking the chain of infection. Cutting off the enemy's supply lines. Let's move to and see how this builds, because to actually win this war, we have to understand how these pathogens travel. It's called the chain of infection. Step 1 is the infectious agent itself. 2, it needs a reservoir, somewhere to live and multiply. 3 is a portal of exit. 4, a mode of transmission, like a cough or maybe contaminated water. 5, it needs a portal of entry into a new person. And 6, a susceptible host. Now, the absolute beauty of this model is that breaking just a single link in this 6-step chain stops the entire invasion cold. For example, if you block the mode of transmission just by washing your hands, the pathogen's journey ends right there. Zooming out to a more macroscopic scale, when a pathogen successfully jumps from host to host, public health professionals classify the outbreak based on its geographic spread. So an endemic is basically a constant baseline presence of a disease in a specific location. An epidemic, though, is a sudden, localized spike in cases. But when an epidemic goes global and spreads across multiple countries or continents, that's when it gets upgraded to a pandemic. Section 4. Medical Diagnosis and Treatments. Calling in the medical reinforcements. So when our natural defenses are struggling, we rely on evidence-based medicine to launch a counterattack. But first, doctors have to gather intelligence, medical histories, physical exams, and lab tests like blood cultures, just to identify the specific enemy. Why? Because medical reinforcements have to be perfectly matched to the specific invader. Bacterial infections are treated with antibiotics, viral infections require antivirals, fungal infections need antifungals, and parasitic infections get antiparasitics. I literally cannot stress this enough. Antibiotics are 100% useless against a viral infection, like a cold or the flu. Using the wrong weapon doesn't just fail to cure you, it actually creates a massive, massive problem. Let's look at a clinical case to see this timeline in action. Imagine a patient who gets ambushed by bacterial pneumonia. On day 1, they experience symptom onset, a really high fever and a severe cough. By day 2, they get a diagnostic chest x-ray and some lab work to ID the pathogen. On day 3, because the lab-confirmed bacteria, targeted antibiotic treatment begins. Fast forward to week 2, the infection is fully cleared and the patient moves right into physical rehabilitation to regain their strength. That is how a patient successfully goes from an initial pathogenic ambush to a complete recovery through evidence-based medicine. So it's a highly effective system, but it brings us to a frankly terrifying question. What happens when our medical reinforcements just stop working? Well, that introduces one of the absolute greatest villains in modern medicine, antimicrobial resistance, or AMR. When we misuse or overuse antibiotics, like demanding them for a viral cold or just failing to finish a prescribed course, we don't kill all the bacteria. The strongest ones survive, they mutate, and they literally evolve to resist the very medications designed to kill them. AMR actively threatens our best medical reinforcements. That's why strict antibiotic stewardship and taking your medications exactly as prescribed is absolutely vital to our collective survival. Section 5. The future of global health. Building a global shield. To build that global shield, organizations like the World Health Organization and the CDC work around the clock to protect entire populations, and they rely on everyday essential infection control. We're talking about crucial tactics like proper hand hygiene, ensuring safe drinking water and food handling, and vector control to manage things like mosquito populations. In a clinical setting, it means rigorous hospital sterilization protocols, contact precautions, and targeted isolation. These aren't just polite recommendations. These are vital, active defense measures that break the chain of infection before a pathogen ever gets the chance to mount an attack. So the crucial point is how we leverage our own biology to protect ourselves on a massive scale. And that brings us to vaccination. Vaccines act as the ultimate training simulator for our adaptive immune system. By safely exposing the body to a harmless piece of a pathogen, we're basically pre-training our special ops memory cells. And when enough people are vaccinated, it creates a shield called herd immunity. This protects the most vulnerable among us, people who are maybe too young or too sick to be vaccinated themselves. It is exactly how we fought back against devastating diseases like measles, polio, and COVID-19. I want to wrap up this explainer with a really powerful thought from our source material. Infectious diseases continue to affect millions of people around the world, but many are preventable and treatable. Good hygiene, vaccination, and strong public health measures can save lives. We are absolutely not defenseless in this invisible war. Through science and understanding, we've built the tools to fight back. But as these pathogens continue to evolve and adapt, the question we really have to ask ourselves is, will we remain disciplined enough in our public health, our hygiene, and our use of antibiotics to keep winning the war? Or will we just hand the advantage right back to the microscopic invaders?